Do you know there's a treatment that can reduce severe symptoms of depression in a very short time? Yes, we're talking about ketamine, a drug that's proving to be a game changer for those on whom traditional depression treatments don't work. If you haven't watched our previous video on TMS, click on the I button and be sure to check it out. If you or someone you know is struggling with treatment-resistant depression, then you must watch this video. Today, we will learn how ketamine works and what its future looks like in the treatment of depression. You won't want to miss this. Hello everyone, I'm Dr. Syed M Quadri, a board-certified psychiatrist, and I have been working in this field for the past 20 years. Today, I'm going to tell you about a revolutionary treatment, ketamine. The information I'll share in this video is based on my own clinical experience as well as studies and research. Ketamine is emerging as a new hope for those battling depression who haven't found relief with traditional medications. So let's learn what ketamine is. Ketamine was originally developed in the 1960s as an anesthetic, but in recent years, it has also been used to treat depression. It is particularly effective for patients on whom traditional antidepressants don't work. Ketamine works by balancing neurotransmitters in the brain, which play an important role in mood regulation. Traditional antidepressants can take weeks to show results, but ketamine works very quickly. Sometimes patients notice a difference after just one session. Let's understand how it works for treating depression. Ketamine works on NMDA receptors, which target the brain's glutamate system. Glutamate is an important neurotransmitter that improves synaptic plasticity and brain function. When ketamine enters the brain, it increases glutamate production, which helps form new neural connections. As a result, thoughts and behaviors related to depression start changing quickly. Ketamine can be administered in two ways, through IV infusion or as a nasal spray called S-ketamine, which was approved by the FDA in 2019. Now let's understand why ketamine is different. Traditional antidepressants like SSRIs and SNRIs work on chemicals such as serotonin and norepinephrine, but ketamine works through glutamate, which alters communication within the brain. Its biggest advantage is how fast it works. Many patients experience improvement within 24 to 48 hours. Additionally, ketamine has been proven effective for patients experiencing suicidal thoughts. So far, we've learned what ketamine is, how it works for depression, and why it's different from other treatments. Now, let's look at its success rate. Research shows that about 50 to 70% of patients with treatment-resistant depression experience improvement after ketamine infusion. While traditional medications may take weeks to show results, ketamine can start working after the first dose. It's especially helpful for those dealing with severe depression or suicidal thoughts. Now, let's take a look at its long-term effects and future potential. Research also shows that ketamine not only reduces the symptoms of depression quickly, but its effects last for a long time. With repeated sessions, ketamine helps the brain form new neural connections, leading to sustained improvement in symptoms. In the future, this treatment could become even more effective, as it is being used for other mental health disorders like PTSD and OCD. Ketamine points to a promising future in mental health care, especially for patients who have not benefited from traditional medications. However, like any other treatment, ketamine comes with some side effects, which need to be considered carefully. Let's now talk about the side effects of ketamine and ways to manage them. Like all treatments, ketamine also has some potential side effects. Common side effects include dizziness, confusion, and temporary dissociation, where patients feel disconnected from themselves. These effects are usually temporary and tend to subside after the treatment is complete. Ketamine should always be administered in a controlled medical setting to ensure that any complications can be managed immediately. Now that we've covered the side effects and precautions, let's look at who might consider ketamine as a treatment option. Ketamine is recommended primarily for adults dealing with treatment-resistant depression or those struggling with suicidal thoughts. It can also be a good option for patients who have not responded to traditional antidepressants. Ketamine is showing promising results for conditions like PTSD, OCD, and some anxiety disorders. Ketamine is an innovative, non-invasive treatment that offers hope to those who haven't benefited from traditional treatments. Its rapid effectiveness, especially for treatment-resistant depression and suicidal patients, makes it a breakthrough option. Many patients experience significant improvement in their symptoms, leading to a notable enhancement in their quality of life through ketamine. If you found this video informative, don't forget to like and share it so others can also benefit from this important information. You'll find references and study links in the description box below where you can gather more information. For more mental health-related content, Make sure to subscribe to our channel and hit the bell icon so you never miss an update. If you haven't watched our video on TMS yet, another advanced, non-invasive treatment, highly effective for severe depression, check the description box or click on the I button. Thank you for watching.